Now, when this clamps down, I mean, it's putting significant pressure on the tip of the penis. And so we expect some changes in sensation to that area or some discomfort. How does a man know if it's too tight? Like, how much pain or
Mm.
discomfort is too much?
Well, you don't see damage until well beyond like a pain threshold, And so usually if they pinch down and it's like sharp pain, that's too tight. But most often what happens is it just feels like odd. It feels like, no, I shouldn't be squishing that much. But if you think even from your hand standpoint, if you take your hand and just squish the head of the penis, you can completely squish that flat. And that's a normal ability of the head of the penis to be able to do. It's meant to be something that can displace, blood, different areas. So it's more so it just that's what's the kind of that learning curve of a week or two, where once they kind of get used to it, then we see, all of those concerns and everything go away. The other one that sometimes we'll hear from people who just don't have a lot of experience with it, they say, "Hey, it's blue and cold." Like, well, of course it is. Like you're putting things in there. But when you do like a vacuum device, for example, people will routinely make the entire penis ischemic for 30 minutes and have a complete tourniquet on there and you don't see any damage. And most studies say with like priapism and things like that, you don't get damage till about 12 hours. And even in the head of the penis, we've done, studies where even when the clamp is fully engaged, there's still blood flow that gets to the area. And so I think the true risk in someone who meets like all the normal indications is very minimal. Now, if you're someone who's losing fingers and toes and you're getting ulcers on the penis without anything, you should not do any sort of clamping or vacuum type devices.